Let me start with Angle's classification, class 1 malocclusion. We all know that class 1 molar relation is mesiobuccal cusp of maxillary first molar occlude with mesiobuccal groove of mandibular first molar. And how to draw it? This first we have to draw the maxillary first molar. Next thing we have to draw is the maxillary mesiobuccal cusp of maxillary first molar occluded with mesiobuccal groove of this occlude in the groove of mandibular first permanent molar. This is the mesiobuccal groove and this is occlude with the mesiobuccal groove of mandibular. Second thing is the canine relation. Canine relation, we have the mesial inclination of maxillary canine occluded with the distal inclination of mandibular. So first thing we have to draw that maxillary canine. Let's draw canine like this. We have to analyze the space for it. This is first molar. So this space is for first premolar, second premolar, third premolar, and this space is for canine. Canine we have to draw like this, like a dimension. Yes, mesial inclination, distal inclination. The mesial inclination of maxillary canine occlude with the distal inclination of this mesial inclination occlude with the distal inclination of mandibular canine. So we have to draw like this. And we have to shade both of the canine and molar as well. Shade like this, and we have to fill the remaining teeth. There is first premolar, second premolar, and first premolar like this, and there are also first premolar, second premolar. Sorry, simultaneously opposite. First one and second premolar. Next thing we have to draw the lateral incisor. Just like this, and canine, and both the lateral incisor and central is just like this. And here also we have to draw lateral incisor and central incisor. Yes, we have to draw like this, and here also like this. Next thing we have to draw the remaining portion just like this, and just like this. And here the second molar, just like. Main thing is we have to draw the mesiobuccal cusp of maxillary first molar in the mesiobuccal groove of mandibular first molar, and the mesial inclination occlude with the distal inclination. This is for the draw. This is only for the drawing of class 1 molar occlusion. Next thing is the class 2 Angle's molar relation. This is a little bit of change. That is the distal. There is in class there is mesiobuccal cusp. In there is a distobuccal cusp, and the distal inclination of maxillary canine. In class 1 is the mesial inclination of canine. And these two things have to be changed. Let's check it out how to be drawn. And first thing we have to draw the molar, maxillary first molar, permanent maxillary first molar, and the distobuccal cusp of this is the distobuccal cusp is occluded with the mesiobuccal groove. Next thing, this cusp is need to be occluded with the mesiobuccal groove of mandibular first permanent molar. This is a distal buccal cusp of maxillary first molar occluded with the mesial groove of mandibular first molar. And next thing we have to, as like the class 1, we have to use space for the first premolar, second premolar and first premolar, and there also first premolar and second premolar. Next thing we have to draw the canine. The canine is this. Here is the canine. It's a diamond shape like this. You have to draw both distal inclination and mesial inclination. And the distal inclination of the canine, this is the distal inclination, this is the mesial inclination, occluded with the mesial inclination. So here is the maxillary mandibular canine, and the mesial inclination occluded with the distal inclination. And we have to draw, fill up the space with both. First thing we have to second premandibular, premolar. Fill up the space with like this. Like this. And we have to draw the incisors, lateral incisors. Just like this. And here also. But here we have to check in, this is class 2 relation. That is, the maxilla is slight protrusive, so you have to draw the incisors like this. Okay, there is a protrusive incisors like this. It's not necessary, even you like it, for the second molar also. And left cervical curvature. Left and mark the shade the molar and the canine. Okay. One thing is that there is two division. We have to remember there is two divisions in class 2 molar relation. That is division 1 and division 2. The major difference is that in the division 1 there is a proclination of the maxillary incisors. In class 1 molar division 1. Okay, this thing is necessary for this pass mark. You need to get more marks, you have to do both the division 1 and division 2. In division 1 there is a proclination of the maxillary incisors, and that's why there is a deep bite possible in division 1. This picture is especially for division 1, where V-shaped maxilla and exaggerated curved space. And in division 2 there is no proclination of maxillary and the breast. There is possible arch square shape and curved space exaggerated and crossway is also present. Next we have discussed about how to draw and classify the class 3. Class 3. And again we have to discuss about class 3 angles classifications and how to draw as a relation. The mesiobuccal cusp of maxillary first permanent molar occluded with the interdental space between the mandibular first and second permanent molar. First we have to draw is the maxillary first molar, permanent first molar. Interdental space between the mandibular first and second permanent, in the interdental space between. This is the mesiobuccal cusp, this is the mesiobuccal cusp, occluded with the next thing we have to draw is this is in the interdental space. So there permanent first mandibular molar come here, and the second mandibular molar come here. So this mesobuccal curve, so excluding in this interdental space between the first mandibular molar and second mandibular molar. And as usual in the class 1, class 2, we have to draw the space for necessary for first, second premolar and first premolar. Here and here comes the canine. The maxillary canine occludes with the interspondal space between mandibular first and second premolar, and they occludes in the interdental space of the first and second premolar. So the first premolar comes here, and the second premolar comes here. You have to draw nicely and neatly in examination. Be patient. The canine occluding in the space between the interdental space of first premolar and second premolar. And where is the canine of mandibular canine? Mandibular canine comes here. Okay, let's draw it. Okay. Right. Here comes the first, second premolar. Here comes the first premolar. Here comes the incisors. We know that in class 3 the mandible is protrusive, so the incisor, lower incisor comes here. And try neatly, draw neatly. Yes. And mark the first molar. Occluding in the space between the mandibular first molar. Here for the class 3, and we all know that there is two kinds of class 3 relation. This is true class 3 true and pseudo class 3. We all know that there is two kinds of class 3, pseudo and true class relation. It is skeletal malocclusion. True class is a skeletal malocclusion as a progressive mandible electromagnetic mismatch, a combination of both. And but in pseudo at rest position it is class 3, but in centric occlusion it is in rest position it is class 3. Rest position is class 3. And while in the centric relation, centric occlusion, it will be class 1. This is class 1. Okay. In rest position is class 1 molar relation. Rest position is class 1 molar relation, and in centric relation, this show the class 1, class 3 molar relation. And so we wind up the angel classification and how to draw. So let's wind up, and next video coming tomorrow.